Hello everyone, Ashley with Amare. I am here to talk to you today about our online course. So our online course is post-op lymphatic massage and finding a therapist. So I have the sales page pulled up so we can go through each thing and what our course is about. But let's talk about why you need it and why I created it. So I do virtual sessions. I also do in-person sessions. And a lot of times, even in my in-person sessions, you guys will find me after you've had a bunch of other massages that didn't work or were super painful or used machines and rollers, and no one explained to you how manual lymphatic drainage actually works to get rid of swelling. No one explained to you the science. No one explained to you the technique. You did a deep dive on TikTok, Instagram, Google, YouTube, Facebook groups, and everyone says something different. But it shouldn't be anything different because we have the science of it. We have a lymphatic map. We have exactly what it's supposed to be. You guys just don't know what that is. So I made an entire course because in session and in my virtuals, you guys come to me and you're like, I went to a bunch of different people. They just rubbed me with oil. I feel like it didn't work, or I don't know what to do. And you're saying the opposite of what everyone else is saying online. So I figured I'd try this. Okay, here's why. Because you either went to someone who wasn't certified properly in manual lymphatic drainage. And in this course, I talk about the 2 certifications you need to look for to make sure the person you're going to is properly certified. That's number 1. Number 2, they were certified, but they didn't really understand the anatomy of the lymphatic system or how to do the technique properly. Like they took a weekend course, which the courses that I tell you guys about, the letters to look for and the places that credential manual lymphatic drainage therapists to do this stuff, it's not a weekend course. It's either 45 hours or 135 hours and then beyond. It's not a weekend course. So either they had some sort of a certification and it was a weekend course and they don't understand the anatomy and how the body works and how the technique works, or they weren't certified, or you were going to someone that just did post-op massage and they were using machines and rollers and oil and all of these different things, but not actually addressing the system, the lymphatic system that is supposed to get your swelling out. They weren't doing the right technique. They didn't know any of the science. They couldn't explain to you how it worked. None of this stuff is a mystery. Guys, manual lymphatic drainage is not just used for post-op. It's also used for breast cancer, for cardiac edema after you have like a heart attack and your legs blow up, for all kinds of medical conditions. It just also happens to work exquisitely well for post-op. So the biggest problem you guys get into, and again, the reason that I created this whole thing is because you don't know what you're even looking for. You don't know what you're asking for. You think fluid's supposed to be draining out of you somehow, but you don't realize it's getting reabsorbed into your body and peed out. You don't realize that this is supposed to be a gentle pumping motion and that's it. But the strength of it doesn't come from rubbing and squeezing and doing tons of things. The strength of it comes from the knowledge and the science of the lymphatic system. So I teach that to you guys in this course so that when you are calling places to find your therapist, you are asking educated questions about the sequence, about this lymphatic map. Where do we start with addressing the body? Where do we go with the sequence to make sure that we're reabsorbing? What's supposed to be happening to the body? What's supposed to be happening to the skin? So that you guys know when you get in the room with that person that they're actually doing the manual lymphatic drainage technique to get your body to reabsorb the swelling after plastic surgery to avoid fibrosis, which I do talk about in the course and we're going to get to avoid complications, to make sure that you're healing properly. All of these things is why I put it all into this one big straight line for you guys so that you, first of all, are informed. The best way to prepare for plastic surgery is to prepare for your recovery, is to understand what you need to do to recover. That's going to be your biggest preparation, because even sometimes your pre-ops aren't until like the day before. There's nothing really for you to do, but planning for the aftercare is the most important thing. Understanding what your body's about to go through is the most important thing. Understanding how we need to take care of it is the most important thing. So, first thing I want to address. So module 3, like I was saying, We're going to go out of order with the modules and talk about the massages first and the most important things you're going to learn, and then everything else that's in the course, because it all ties into itself. So your massages, module 3, is where I teach you the sequence of how this map works, how your body drains fluid. So as an MLD therapist, we learn this thing inside and out. We learn the sequences. We learn how things are supposed to go in the massage. What's supposed to happen first, what's supposed to happen second in order to get your body to reabsorb that swelling. So there is an actual sequence as to how we address the lymph nodes and then how we address the swelling in your body. I teach you guys that because an MLD therapist, someone that is working with this system all the time, is going to know how to do that. Now, everybody's going to do it a little bit differently, right? So there are 2 different certifications. There's the 45-hour one and the 135-hour one. Obviously, one of them is going to have a lot more education knowledge than the other. That doesn't mean that they're bad or one is better than the other. Just because they have a different certification doesn't mean they're not as skilled. They absolutely can be, but it's based on their knowledge and how they're using it. So when we're talking about learning this map, if you are asking educated questions to your therapist, as I am teaching you all of this that we learn in school, as I'm teaching you as the client how to understand this in a very simple way, you can talk to your therapist before you book and be like, hey, I know that you have to address the body in a certain way to open up certain things first so other things drain. How do you do your sequence? I'm just curious. So that you ask, and if they tell you, oh, we start here and then we go here and then we, work on this area and we're using this kind of a technique and this kind of a pressure, and they're actually explaining it the way that I do to you guys in my videos, then there's someone who understands how the body works, and they're going to be doing the proper technique. They're not just going to be rubbing you with oil. If you call a place and you ask them, okay, well, what's the pressure like? What's the technique like? What are you actually doing with your hands on my body? Like to my skin, how's it going to work? And they're like, oh, it's a gentle pressure. Oh, it's more gentle than a regular massage. And that's it. And then you keep asking questions and they still can't explain it. They don't really have as in-depth of a knowledge that they should have for what they're doing for you after plastic surgery. Doesn't mean they're a bad therapist, just means that they're not the right fit. Now, just because this is the other reason this module is so important. So this is now going into module 5, which is where I talk about the credentials. So in module 3, I talked to you guys about your massages, how they should never be painful, what they're doing with their hands, how the sequence should go, why the sequence goes that way, and how to direct your therapist. Because if they have like a 45-hour base certification, they will know how to do the technique. They will know exactly what lymph nodes to address and where. They will know how it's supposed to feel pressure-wise, and they will give you the best, most effective manual lymphatic drainage massage you have ever had, and you will see an incredible decrease in swelling. But they may know nothing about plastic surgery. They might not know how to position you. They might not know what it means to have a BBL or a breast augmentation. That comes from me being a plastic surgery recovery specialist, but that doesn't mean they're not what we need. It just means you have to have proper expectations of why you need this therapist in the first place and what their role is in your recovery. So over this entire course, I'm teaching you guys how to take care of your swelling, what you're doing with the garments, the phases of wound healing that you need to understand in order for your body to heal and know when things are happening in your body, what lymphostatic fibrosis is, so fibrosis, how that forms, how to stop it from forming, how to not aggravate it if it has formed, and how to turn it back to swelling so you can pee it out, and supplies that you can use to help. And fun fact, it is not rubbing through your body. You will learn all about fibrosis in this course and how to get rid of it and what causes it and how to avoid it. Things that don't work for your lymphatic system, like rollers and heat and ice and things like that we need to be careful of. Not that they may not work somewhere down the line, but that we need to be careful of in those first 6 to 8 weeks of healing. So I load you guys up with enough information to be able to advocate for yourselves post-op, as far as talking to your therapist and explaining to them, okay, this is what's going on. This is where I have swelling. I know that in order to get this swelling moving, you have to address these areas first. So can we start with this, and this, and then focus on this afterwards. Because according to the lymphatic mapping and the science, this is how it's supposed to go. Having that amount of education is going to be so helpful for your therapist because you guys are now on the same team, speaking the same language. And you guys know, if you've seen my videos, if you know me at all, I water things down for you guys in such a palatable way that you can understand and give you so many analogies. You will be able to talk to your therapist and explain this stuff, and you'll be able to understand it. I break down the science of how the pumping motion works, why it's a gentle skin stretching motion, the anatomy of it. We have an entire module, Module 2, where I talk about the science of the lymphatic system. Your lymphatic system is responsible for getting rid of your swelling. If we are not addressing that system directly and working with those vessels, which are only a hair thick and lie a hair deep under your skin, if we're not addressing that system and we're rolling over it or doing some sort of oil rubbing massage and not actually systematically dilating those vessels to absorb the swelling from between your skin and your tissue where it's starting to pool after surgery, we're not going to get that swelling out. We're going to move it around in the tissue, but it's not going to reabsorb. Things like that you guys need to understand, because if you walk into a room and let's say, because this happens all the time, and again, the primary reason I created this course, I have a virtual with someone. I explain to them what it's supposed to be like. I explain to them the sequence. I explain to them what it needs to be. I even call a place for them and I say, hey, saw you guys do manual lymphatic drainage. Do you have a CLT or MLDC certification? And they're like, yes, we have an MLDC. Okay, cool. What school? They give me one of the schools. Okay, cool. It's one of the schools that I've went to. I have like 5 MLD certifications from all the different schools because I want to know what everybody's teaching. So it's one of the ones that are on the directory. Cool. All right, awesome. What are you doing with your hands? Oh, it's a gentle skin stretching motion. It's really light. It's like a light massage. Okay, cool. Awesome. Do you use any kind of oils or anything? Yeah, we'll use like CBD oil sometimes. If we're supposed to be stretching the skin to dilate those vessels, we're not using oil. Ever. So that's already a no. Or we'll find a place, they'll give us all the right answers. My client, true story, gets into the room. I vet this person, I verify them, everything checks out. They say all the right things. She gets into the room and they put a heating pad on her stomach. Fun fact, just for you guys, little freebie, heat is a vasodilator. Heat will cause more swelling. Heat is not something you should be using if you are swollen. You should not be putting heat on your body. They slap a heating pad on her at the end of the session. She has her virtual with me the next day and she's like, I went to this person and it felt great in the moment, but then when I got home, I started feeling really swollen and red and it started feeling really tight and I don't understand. And I'm like, okay, this doesn't make sense to me because I vetted this person. They should be fine. Walk me through again what happened. So she tells me, yeah, and then they put a heating pad on me at the end, right over my tummy tuck incision, and it just blew up the next day. I don't understand why. And I'm like, because heat is a vasodilator, and anybody who's trained properly would know that. Here's the thing. If you guys know that, you can find someone that's doing the MLD and then tell them, hey, I don't want the heat, just do the massage. Or hey, I don't want anything else, just do the MLD. Because a lot of massage therapists will try to layer therapies to help you get better faster, but sometimes it works against us. So I teach you in this course things like that to avoid and how to direct and guide your therapist, because it's not that they're a bad therapist, they may just not know how to handle post-op situations, which is why you need to know how to handle post-op situations for your body and what's going on. So that's Module 3. I teach you about the science in Module 2 of the lymphatic system to understand why the technique works, why your body is swelling, why your lymphatic system works. But also in there, I teach you things like avoiding salt, drinking water, your garment, all of those things in Module 2 that work with the lymphatic system to help you get the swelling down. In Module 1, I teach you guys why the swelling is there to begin with, because we need swelling. If we didn't need swelling, our bodies wouldn't swell. It wouldn't do what it didn't need. Swelling is healing juices. It carries the proteins, it carries the fats, it carries the white blood cells, all the things that are going to make that new tissue and make sure you actually heal. So you need your swelling to heal. That's number 1, Module 1. We learn about why swelling's created, why we need it, why it's there, all that stuff. Module 2 is the lymphatic system, the thing responsible for getting rid of the swelling. Module 3 is the manual lymphatic drainage technique that gets rid of the swelling by engaging the lymphatic system. Module 4 is all the things you need to know about your massage. So when do I start? How do I know what manual lymphatic drainage massage really is? When do I do cavitation? When do I use rollers? What's the difference between post-op massage and lymphatic massage? All those things are in Module 4. Module 4. And then Module 5 is how to find your therapist. So now that we know that it's not post-op massage, it's manual lymphatic drainage, it's nothing but the hands only, manual lymphatic drainage. We know how the swelling works. We know why it's there. We know how the body naturally gets rid of it, which is manual lymphatic drainage, lymphatic system, getting rid of it. And this is the other thing. Your body, and I say this in all my videos, your body gets rid of swelling on its own all the time. You stub your toe, a few days, it goes down. Why is plastic surgery different? Why is the swelling hanging around so long? What's happening during our recovery that's making it stick to our body so much? So we cover that as well in several of the modules, actually. Why is the swelling still here? And what happens if we leave it there for too long? It starts causing lymphostatic fibrosis. It starts causing those hardness, the lumps, the bumps. It gets to the point where even 6 months post-op, where you're just like, oh, well, this is just what I look like after surgery. The swelling never went down, so these are my results. No, you can heal and still have swelling inside of you. So we talk about that as well, like what happens if we don't get rid of the swelling, and why we need to work so hard to get rid of the swelling after surgery, whereas our lymphatic system is getting rid of swelling 24/7, as we learned in Module 2. It's doing this on its own. We learn how, and the importance of learning how is so that you learn during your recovery how your lymphatic system is supposed to be working, how to work with that system to boost it. Manual lymphatic drainage is what boosts your lymphatic system, getting it to get rid of the swelling. You can't, when you stub your toe, you can't cut it open and drain swelling from it and expect it to just heal perfectly fine like nothing ever happened. We hear these stories about people who get knee surgeries that will go and get their knee aspirated, drained over and over and over and still have swelling. Why? Because swelling is healing juices. Module 1. Module 2, your lymphatic system is responsible for getting rid of swelling. Number 3, how do we get rid of swelling and what happens if it doesn't go away? Manual lymphatic drainage. And then we talk about manual lymphatic drainage and how that works to naturally boost your body's system of getting rid of swelling. And then we talk about how to find someone to do that. So when we're talking about how to find someone, we talk about the difference in certification levels, what they are supposed to know based on their education, what you need to know to be able to guide them properly, and how to pick the right one. Because let's say you do have a plethora of MLD therapists in your area that are certified. So in that same module, vetting your therapist, module 5, I have a slide. I also have a PDF for you guys to purchase because it's a little bit easier and you can have it up in front of you while you're calling these places. The Vetting Your Therapist guide is included in the module, so you don't have to buy it if you're buying the course. You can just pause the video, take a screenshot, and use it that way. But I have 4 different schools that certify in the nation manual lymphatic drainage therapists with the 2 credentials that I talk about. So you can type in your zip code and populate a list from all 4 schools. Maybe you have like a lot of options and you're like, I don't know which one to choose. I have so many. I don't know which one's better. It's about the level of education and the accessibility, because the 135-hour courses, most of them are, I shouldn't say most, a lot of them are physical therapists working in a physical therapy office, and you may not be able to have access to them after post-op. And you will have a lot of MLD therapists, the ones that are 45-hour base training, and they're fantastic, but they're not used to dealing with post-op, or they don't really understand the things that you need post-op. So you need to be able to guide them. So this is the difference, is one isn't better than the other. It's which choice is best for you, for what you need, and which level of training is best for you. Yes, a CLT with 135 hours may have a lot more training, but how do you know if they're going to be able to help you post-surgery? Just because it says CLT doesn't mean they're going to be able to help you. Just because it says MLDC doesn't mean they're going to be able to help you. And you don't even know what those things mean. You don't know what those letters mean as far as their level of education, where to find them, what they're going to be able to help you with, how much they're going to know. That's why that module is so important, because on that Vetting Your Therapist guide, I give you questions to ask and I write the answers underneath. And those answers are based on what you've already learned in the course. So again, what school? What certification level do you have? What are you doing with your hands? How is the sequence supposed to be structured? All of these things, I write the questions out for you. And those questions in Module 5, you learn throughout Module 1 through 4. So I'm literally teaching you all of it, walking you through it, giving you the essentials that you need, first of all, for you to understand what's going on during your recovery. From liposuction, from tummy tuck, from BBL, those 4 phases of wound healing still happen the same way no matter the surgery. Swelling still happens the same way no matter the surgery. So all of this is applicable to all surgeries. It's you understanding the phases your body's going through and what it needs when. It's not that something's good or bad. It's, do we need it now or do we need to wait? Your manual lymphatic drainage massages from a certified manual lymphatic drainage therapist should be happening in your first 6 to 8 weeks, if not up to 3 months, if you still have swelling and fibrosis. After that, you can get all your other kinds of massage, wood therapy, cavitation, cupping, all the other post-op massage. So knowing what you need when in your recovery is what this whole course is about. Knowing when fibrosis is a potential to start, knowing when to start making sure that you're getting your massages, knowing who to get them from, knowing what your body's going to go through as far as swelling, when it's going to show up, when it should start decreasing, so that you guys can track all of this. The other thing we talk about, so our bonus module, we talk about fibrosis through the entire course. I am going to be releasing an entire course specifically on fibrosis, like a mini course. But in order to understand fibrosis, you need to understand swelling, because fibrosis is a complication. It is a complex form of swelling. It's swelling that has changed its form. It's like going from a solid to a liquid to a gas situation. It's going from a liquid to a solid. It's condensing and congealing. So fibrosis was originally swelling that is now turning into fibrosis, now clumping together and becoming stagnant. Lymphostatic fibrosis. You'll learn all about that in the course in the first 3 modules. The other thing you're going to learn about is garments, because when we talk about the lymphatic system, when we talk about swelling and how to get rid of it, we're talking about things that support the lymphatic drainage that's happening naturally in the body. And again, guys, just a side note, manual lymphatic drainage. We are manually pumping the body to dilate the lymphatic vessels, getting them to reabsorb your swelling so that you drain it out back into your subclavian veins, which you'll learn about in the course, back into your bloodstream and pee it out. That's how it works. We are manually kicking on the lymphatic system to get it to drain out through your urine all of the swelling. That's how it works. And you'll learn all about that. So garments and supplies, our bonus module is all about garments and supplies. So a lot of things you guys use that are interrupting your healing, like rollers and things like that, or the difference between store-bought arnica and the arnica that you need after surgery, or the different kinds of garments and why you need them, which I said we talk about throughout the course so that you get the full picture. But things like heat, rollers, ice, deep pressure, all of that stuff is covered in that bonus module. So we talk about the supplies you need, like lipofoams, how to use them and why to use them. And we talk about the things that you're currently using, like Dial, Dove, and HipaCleanse, like antibacterial soaps that are ripping up your skin if you use them for too long, and what to use instead. So it's a lot of the most common supplies that you see floating around on the interwebs. And are they good? Are they bad? Should we use them? What should we use instead that's better? So that's what that whole module is about. But the first module is like the intro, right? So it talks about me. And then the first real module that I think is the first real module is the science of swelling. So what is swelling and how does it work, right? And then swelling after surgery and how do we get rid of it? Manual lymphatic drainage, what to expect during your lymphatic massages. Finding and vetting your lymphatic therapist, and then your bonus module. So it's technically 6 modules. If you count the intro, I say 5. So in the first module, just to tie it up in a nice little bow, like I always do, in the first module, we're talking about, okay, we had surgery, we're going to have swelling. Why is it there? Why do we need it? what is its purpose, and how do we make swelling work for us, right? Rather than just being like, oh, I'm just swelling and it's so painful and I don't know what to do. How do we make it work for us, for the healing process? Like, what is it doing? How do we work with that, right? And then the second module is swelling after surgery and how we get rid of it. So that's where I talk about the lymphatic system, is that whole module. So your body naturally gets rid of swelling 24/7 on its own via the lymphatic system. Why the heck isn't it doing that after surgery? Why am I so swollen? That will lead into what to expect during your lymphatic drainage massages, because how do we get rid of it? Manual lymphatic drainage. That's why it's called swelling after surgery and how we get rid of it, because it's manual lymphatic drainage is how we get rid of it, how we stimulate our body's natural drainage process. So it's that module is module 3, all about the things that need to be happening during your massage. And if those things aren't happening, you are not going to have a swelling reduction by that massage. And then after that, finding and vetting your therapist. So all the things that I teach you about how this map works, how your sequence of your session should go, what should happen first, second, and third, and why, how the technique works, how to know if the technique is being done right. All of that leads into finding and vetting your therapist, because now that you know what swelling is, what the lymphatic system is, and how manual lymphatic drainage works to manipulate the lymphatic system to get you to reduce the swelling, 3, 2, 1, modules 3, 2, and then 1, we can now talk about how to find somebody that understands all of that and can work with it and do what we need. And then bonus module, module 5, is all about the products that you need, post-op products for swelling. So all the things that you should be using or shouldn't be using. The most important thing that I want you guys to know about this course is when you are preparing for surgery, if you don't understand how to take care of this afterwards, you will not heal right. Or you will heal, but it won't be your full result. Or it will be your full result, but you will have a very tough time through your recovery. You will spend a lot of money on a lot of different kinds of massages, never understanding what the heck manual lymphatic drainage is. You will spend a lot of time with a lot of different Facebook groups, TikTok, Instagram, YouTube, trying to figure out what is this actually supposed to be? How do I find someone? How do I know that this is the thing that I need? Like, I keep hearing lymphatic massage, manual lymphatic drainage, but why? Why does it work? And how does it work? And how do I know if it's working? That's the other thing. How do I know if it's working? Because on the flip side, I do have a lot of people come to me and be like, yeah, all they did was this. They just did like a brushing stroke on my skin, and I don't know that it did anything. Well, that's not manual lymphatic drainage either. That's called effleurage. That is a massage technique called effleurage. Manual lymphatic drainage should be a scientific directed stroke. And you will learn about that. A scientific directed stroke to get your body to reabsorb that swelling. And it's supposed to feel so good. If you are not in love with your massages, if you are already post-op and you're like, my massages are painful, or they're just oil rubbing, or they're just whatever, or like, oh my God, they're super painful, but then I look so small, so it's fine. If it doesn't feel amazing while you're getting it done, it's not the right kind of massage. If it's painful, it's not the right kind of massage. But again, how are you going to know any of that if you don't even understand what the massage is? What's supposed to be happening to you in the room? So this whole course was built off of that one client and that one story. And then even when you guys come to see me, you're always like, oh my God, I took a Vicodin and a Percocet and Lord knows what else before I came here because it was going to be so painful. And I'm like, you didn't even understand what the massage was before you got here. But now you're here and you got lucky because I'm going to explain it all to you. I don't want you guys to just get lucky. I want you to be prepared for surgery. And being prepared for surgery, the actual surgery part is the easy part. That is the easiest part. You are either in twilight or you're knocked out. The surgery, you are just there and the surgery just happens. The hardest part and the thing you need to prepare for after surgery is your aftercare. And you do that with this course by learning Module 1, what is swelling and why do we need it and how does it work? Module 2, what is the lymphatic system? How it's responsible for getting rid of swelling. Number 3, how manual lymphatic drainage manipulates and boosts the lymphatic system to get rid of swelling to prevent complications like fibrosis. Number 4, how to find your therapist, the person that understands everything you just learned. And what I'm teaching you is the base, the very base knowledge of what should be going on during your manual lymphatic drainage sessions. And then number 5, all the things that you're doing at home that should be helping your lymphatic drainage of your body, that should be helping your swelling, that should be helping you heal. Because your lymphatic system is the key to getting your results. You will never see your results if you still have swelling, even a year out. You will still look like you had nothing done. I just did a YouTube video on why the lipo didn't work, why you feel like lipo doesn't work, because you don't see any results. Your manual lymphatic drainage massages and your lymphatic system are the key to getting you perfect results after plastic surgery. But you need to know what exactly that is. So this is what the course is for. I know this is a long video and it's like the big rundown of it, but I wanted to make sure I included everything. So the most important thing, if nothing else, the 2 most important things you need this course either before surgery or even if you're finding this after surgery, the 2 most important things: 1, knowing what's supposed to be going on in the room during your manual lymphatic drainage massages, how the sequence is supposed to go, what the pressure is supposed to be like, what they're supposed to be doing with their hands, how they're supposed to be working. Your therapist, what letters they're supposed to have after their name, what those letters mean, what you need to expect from them as far as how they're going to be able to help you, right? So questions that you should be able to ask them, like rather than just saying, oh, I'm really swollen here today, aren't I? It should be, okay, this wasn't swollen like this yesterday. We've been tracking it. Why is this swollen like this today? What's going on with my lymphatic system that this is swollen today? What am I possibly doing in my recovery? You will be able to answer those questions yourself after taking this course. Is it the garment? Is it the sodium? Is it the supplies? Now that we know how the lymphatic system works, how are we getting in the way of our body naturally draining the swelling? Because when you guys, and this is, swelling after surgery, how we get rid of it and why it doesn't go away. When you guys have surgery, you tend to do too much. You go to these massage places that use cavitation wood therapy, cupping, and oil rubbing and carboxy all in one day. You do too much and you get in the way of your healing. And you stop your lymphatic system from pumping and doing its normal job. You're squeezing yourself into a garment that is 5 sizes too tight, crushing your lymph vessels, backing up swelling, and hardening yourself. We do too much. Your massages, you think, need to be so extra and so much, and you need to be like doing massages every single day. Granted, if you find a manual lymphatic drainage therapist, and I talk about when and how many and how frequently you should be going to get your massages, when you have a therapist that is actually doing true manual lymphatic drainage, yeah, if you can get there several times a week, that's amazing, because we're not getting in the way of the lymphatic system. We're working with the lymphatic system, your body's natural swelling drainage system. But that's not always the case. It's not always a good thing to be doing them all the time back to back, which I also talk about in the course. So you guys tend to go so hardcore and do so much with your recovery. And you go in all these different directions because you're hearing all these different things online. This is your straight line. Post-op lymphatic massage and finding a therapist course is your straight line for recovery. Is teaching you about your swelling, is teaching you about fibrosis, is teaching you how to avoid fibrosis, how to avoid swelling, is teaching you about your body's natural drainage system and how to work with your body to heal after surgery, is teaching you what should be happening in the room during your massages, what your therapist should be doing if they're doing actual manual lymphatic drainage, what you need done during your post-op massages lymphatic drainage, what your therapist's credentials should be like to know that they know what they're doing with your swelling after surgery, and they're properly educated, how to find those people, and then all the other little things at the end, like the arnica, like the foams, like the rollers, what we need and what we don't need. This course is your straight line for preparing for surgery as far as your recovery. It's got everything in there. And then there is the bonus PDF. So if you guys wanted to download the PDF so that you can actually click the therapist directories, but also have that sheet printed out in front of you when you're calling these places, that's also in there. So it's got the 3 golden rules for MLD. So the 3 things, like the surefire way to know if the massage you're getting is actually manual lymphatic drainage. The 3 golden rules that should always happen. That should always be there during your massages to know if it's real MLD or not. The clickable links for the therapist certification schools so that you can populate your lists, and then your vetting questions so that you can actually confirm before you book with your therapist that they know what they're talking about, because now you understand and you know what you're talking about to know if your massages are the right thing or not. So all of that is on there. You can purchase the course. It is $150. You are watching this video either on YouTube or on the enrollment page. You can purchase it through our Shopify. We offer payment plans through Shopify. So through our post-op shop. The link is in our bio on our Instagram. Shop Pay, Shopify offers Shop Pay, so you can do it in installments if you need to. If you go to our Instagram and you click on the picture, it's the first thing in our link in bio. It'll take you to our post-op shop page where you can buy it right there. You will get, once you purchase it, you will get an email from our Post-Op Academy asking you to create an account. It'll say you've been enrolled in the course, and then a few minutes later, you'll get an email asking you to create your account. It has your email already populated. You'll create your account, and then you have access to the course. The course is forever. You will have the course for as long as you live, as long as you would like. So you can always go back. I mean, you're not, right, let's say we're having surgery, we're one and done. But your lymphatic system, learning about it, learning how stagnation works, learning how fluid builds up, learning how fibrosis works, all of that is really valuable postpartum. It's really valuable with autoimmunes. It's really valuable when you're dealing with someone who has lymphedema, with any of those other conditions. So you're not just going to learn about it post-surgery. You're going to learn about it being the lymphatic system. You're going to learn about swelling in the lymphatic system in all areas of life. So when you come across someone who has massive amounts of swelling, you're going to know how that swelling works and why it's there. You're going to know how the body gets rid of that swelling. You're going to have somewhat of an idea of what's going on and what direction to point them in, like, hey, I know some things about the lymphatic system. You should go see a lymphatic drainage therapist, and here's why. You'll have enough information to tell them, and honestly, you may even have some education that your doctor doesn't have, like a lot of education your doctor doesn't have, your surgeon, because they're not lymphatic specialists. I am. They don't specialize in swelling. I do. All they specialize in is the surgery. I specialize in the recovery and the aftercare, making sure that you guys are recovering and healing properly, making sure that that swelling's coming down. And the only way for me to make sure that I can do that is by teaching you about it. So all the stuff that you would get in a virtual with me, our virtuals are $135 for 45 minutes. You get 4 hours of exclusive content that is not on YouTube, that is not on Instagram, that is nowhere else. This is 4 sessions with me in one course. Because when I do a virtual, we spend 1 session just explaining the therapist stuff, talking about your therapist and what they should be doing in the room. We spend 1 session just talking about fibrosis. We spend another session with me telling you how swelling works in your body and why it's there and how we need to maneuver to get it to work for us and filter out of the body and have it actually work right to heal the tissue properly. This is 4 virtual sessions in one. So this is like having 4 sessions with me, either in the room, except my hands aren't on you. I'm giving you the things to find someone, either in the room or virtual. And it's $150, and you guys can get it through Shopify, amarepostopshop.com, or if you're on this enrollment page, just click the Enroll Now button, and you can sign up directly on our Post-Op Academy. And if you're on YouTube, it is amarepostopshop.com. Like I said, the link is in our Instagram, in our bio. It's the first thing up there, as well as in the description box below this video. That link will also be in there. I'll make sure to add it for our YouTube. But guys, that is a lot about our course. If you have any questions, feel free to DM me. And questions about what's contained in the course, DM me on Instagram, because then I will make a reel answering your question. so that it will go up there so everyone can see it. And I'll probably even add it to this page, this sales page, so that we have a little more information. I want to know what questions you guys have about this. But this, just to be very clear, this is not a lymphatic massage certification course. This is not, I want to get certified in MLD. Those courses are taught by accredited schools that have continuing education and board accreditation to teach it. They are medical and science courses. They're taught to nurses, they're taught to physical therapists, they're taught to massage therapists. You have to hold a state license to practice before you can even take these courses, which I explained to you guys as the client in these courses, in my course, for these MLD certification courses to be a lymphatic drainage therapist. You have to hold some sort of a license to begin with. Any of the schools that are listed on here, if you do not have a license where you're allowed to practice this technique, like a state license, they will not let you take the course. So that's another way that you know that students, therapists, MLD therapists, manual lymphatic drainage therapists that come from these directories are legally allowed to practice. Because if they aren't, if they don't hold these credentials, then they didn't take the full accreditation for manual lymphatic drainage. They did some sort of like a continuing education 20-hour, just kind of intro, soft intro, get to know what it is, and they're not going to be the right candidate for your surgery. So that's another little nugget of wisdom for you. But that's pretty much it, guys. I mean, I've talked a lot about this. Like I said, if you have questions, DM me. I will post your question publicly and respond to it so I can kind of elaborate more. But just to, again, wrap it up, you will learn in this course all about your massages, what should be going on in the room, what to expect, how to know if it's real, how to know if your therapist is real and doing the right thing. Fibrosis, how it's made, why it's made. It is a complication after surgery. So how do we stop it from being made? How do we stop it when it's already being made? How do we reverse it and get rid of it and turn it back to its original form, which is swelling, and pee it out? Your garments, why we need them, what their job is. Your massages, why we need them. We need them for swelling, but why? How do they work? Which is your lymphatic system? How does your lymphatic system work? Why is it called lymphatic massage? How does the swelling work? Why is it there? Why do we need it? What do we do with it if it is there? How do we get rid of it? And then all the other common little things like rollers and all the post-op supply things, and what you actually need and the stuff that you don't need. The stuff that's just kind of like people are trying to do things just to do things. They don't really understand the science of why or how, because if we did, we wouldn't be using them. So guys, that's pretty much it. Ashley with Amare. It was nice to talk to you guys. I hope you enjoy the course as much as I did creating it, and I hope it's really helpful. And that's it. I will see you guys soon. Bye.